For decades, doctors have been prescribing SSRIs and psychotherapy as a treatment for mental illness. Before that, we had treatments like electroshock therapy, lobotomies, and other extreme methods. In the early 1950s, psychiatrists started researching psychedelics to see their effect on treating mental illnesses. And centuries before that, cannabis was used for medical purposes, both physical and mental. Unfortunately, both of these were brought to a halt due to the country's social and political views, as well as the 1969 Controlled Substances Act, which placed drugs into Schedules 1 through 5. The schedules classified drugs by their risk to the human body and brain. But on November 6, 2018, Proposition 2 was voted for, which legalized medical cannabis in the state of Utah. Although it is not legal in Utah to use cannabis recreationally, it can now be used to help those with physical illnesses as well as mental illnesses. With the rise of social media in younger generations, there is now more than ever an accepting space for people to talk about and recognize their own mental health struggles and seek treatment for it. We are now seeing how common it is for one to struggle mentally no matter their age, race, sexual orientation, gender identity, and background.
In terms of finding out what marijuana is and what it does for people, I was in 7th grade, and a bunch of girls were talking about how this girl just got caught smoking in the bathroom, and I thought for sure it had to be cigarettes. I thought that was the only thing that people smoked. And I was like, 7th grade? Like, I know people do that. But then they were like, no, Riley, like, it's weed. And I was like, what do you mean, weed? Like, so then they had to explain it to me, obviously. I had a friend get caught with a bag full of it, so she had to do like so much community service and stuff, and I ended up going with her to all of that community service. And like during that time is when I kind of really got to ask her questions about like what is it, what does it do for you, and I was just terrified of it, you know, and like especially because my friends were getting in trouble, like they can't hang out with me anymore. I'm just seeing all these negative, like, obviously effects of marijuana. So that was like when I first found out about it, and the first time that I found out it could be used for medical purposes. So my father and I don't really align on like a ton of views, politically, socially, spiritually, economically. And one time we were stuck in a car for 12 hours together. So my father and I got into a discussion about how I only think it's a bad thing. It was when it was being voted in the States. And I asked my dad what he was planning on voting, because this was my first time ever getting to vote. I didn't get to vote for the presidential election that year prior because I was 17. I was like, what'd you vote for, Dad? And he was like, oh yeah, I voted for them to like medically legalize it. And I was like, oh my gosh, I was like, why would you do that? Like, I've only ever seen like negative effects. I was like, I don't care if they legalize it, people are gonna still get it illegally in all these bad ways. Like, and my dad actually was the one that was like, so I looked into it, like it actually has so many great properties for you. And like my dad is very much into his religion. He's very much into like, he's a right-winged Republican, like so many things. So to hear my father say that medical marijuana was like something that was very beneficial for people actually is like what opened my eyes up to the potential of it being a good thing.
My name is Christopher Romney. I'm a nurse practitioner and medical director of Empathetics. So cannabis is, trying to be basic, you kind of have your cannabinoids. So there's different ones, like there's CBD, there's CBG, CBA, CBN. So there's all these different cannabinoids. And the easiest way to explain it, they're kind of, in a sense, more kind of your anti-inflammatories. They really help with inflammation, kind of help you relax, maybe sleep. So those kind of have their own little mechanisms of action, I guess you could say. Then you have the THC. The THC alone by itself is great for pain control. That's one that can give you the euphoria, the high feeling that people talk about. And so in Utah, you can heat it up with devices we have. Heats it up more like an oven, just kind of brings it up slower to temperature. And so that preserves those cannabinoids, some of the medicinal part of it. And so your body, everyone's body has a cannabinoid system. And so that's kind of what we're now studying in science, is finding out how those works. Say you take a gummy and you ingest that, you're going to have THC, and depends on how much, in that product you're going to have, and then you also have the cannabinoid part of it. So you kind of ingest those together, and they kind of are symbiotic, and it helps kind of get that medicine into your cells and find where the pain's at and kind of calm those receptors down, and that kind of what decreases your pain if you're going for that way. So that's kind of how they work together. So you can ingest it, which is again processed through your gut and through your liver. You can inhale, which goes more into your lungs, and there's your lungs are very vascular, so it gets into your system a little bit faster that way. But basically you have your cannabinoid system that you're trying to decrease your pain, decrease anxiety, and then you have your THC, which is more kind of the instant feeling you're going to get on it. When you take them both together, you get more of a body. I don't like to use the word high, but more of like a body feelings, like with pain. If you use both together, you're not just going to be high and out of your mind that way. It's more of just a body control where you're just finally like, oh, I'm finally getting the relief that I'm looking for when you kind of combine them.
My name is Shane Erickson, and I'm the owner of Men's Tribal House Sober Living, which is the first cannabis-friendly rehab or sober living in the state of Utah. I also have a company called Empathetics, and that is a medical clinic that specializes in medical cannabis. I believe in the helpful properties of not just hemp, but medical cannabis. Over 10,000 patients have got their med card through us in Utah. So Utah has a really robust medical cannabis program. It's among the most liberal in the whole state. We don't have a recreational program, so any adult can't just walk into a Utah dispensary and buy what they want. They need to have a qualifying condition. Some of the biggest categories are chronic pain, that's by far the biggest. PTSD is one of the top categories. All of the cancers qualify a patient if you're end of life and if you're on hospice. We recognize all of those 14 conditions, and usually people are already diagnosed with one of those conditions. They come to us after already receiving a PTSD diagnosis from their therapist years ago, and they come to us as a cancer patient receiving treatment somewhere else, but for one reason or another, their primary care physician doesn't want to issue them a medical cannabis card, because there's a lot of misunderstanding around cannabis. So a lot of doctors are hesitant because their DEA number is a federal DEA number, right? And so there's kind of some gray areas. Each state treats it differently. And the Department of Health runs this program it's called the EVS system, the Electronic Verification System. And that's where patients apply for their med card, and doctors interface with that system, and the state of Utah emails out a med card to each patient. It's good for 6 months. And then you can visit any one of the 14 medical cannabis pharmacies in the state.
I started, when I realized that I had an issue that I wanted to fix, I thought that it was me having ADHD and ADD. So I went and tried to get prescriptions for that. So I was on Adderall, and they just kept upping my dosage when I didn't find that it helped, or my body would get used to it and help me for a little bit. And I just wanted to feel engaged and wanted to finish a task that I started. I wanted to have the desire and the willingness to do those things. And I obviously attributed it still to the ADD and the ADHD, but not even considering that it might have been depression or anxiety or stuff like that. So I was using Adderall for a while, and then finally I was like, you know what? I don't even think that this is really helping me for what I want. I should try other things. I use marijuana for anxiety, and being able to freely and legally use it, the anxiety is pew, poof, you know what I mean? So much better. So seeing that with my friends made me really want to get it, and I went through a dispensary actually to find all of the benefits. I went to Wholesome Co. and found the best way to speak to a pharmacist, find a doctor, the right way to go through it, instead of just oh, maybe someone's sketchy. So many people were oh yeah, I went and met my guy at a Starbucks down the road. And I'm like, what? You went to a Starbucks down the road and you just gave you a medical card? I don't know about that. So I went actually through the dispensary and got to talk to a pharmacist. And then obviously after that, again, you have your interview with the pharmacist in order to actually order from a dispensary. And I don't know, just so from there I found a doctor. I met with them, spoke to them about all the things that I've been experiencing that I feel could be helped with medical marijuana. And that sit down session with that doctor made me feel a lot better about it, because obviously you're a little nervous about it, but you're going there because you want to do it. But the doctor made me feel so much better about it, talking about how they've seen so many benefits of people who have come in with the exact same problems that I've had, and seen such a better way of life for them.
My oldest patient I had was 91 years old. She was on hospice. Her kids finally talked her into coming to get her cannabis card to help her through the end of life. And after her first 3 months, she was able to get out of her bed, which she hadn't got out of in a couple months. She was walking stairs, which she hadn't done in a couple years, and she's now going to the gym for an hour a day. No, not intensive gym, but her kids are there to verify it 5 days a week. She's in the gym now, and she's 91 years old, and she contributes it all to cannabis. She's able to get off all of her other medications, and she's just excited to live her life now and wishes she'd been on 20 years earlier. I think a lot of people, there's a lot of stigma on, they just want to get high and they just want to whatever. But most of my patients are using it to be able to continue to work so they can control their pain and get on with their life and be able to focus and be a productive member of society. I have many, many patients who are addicted to other medications. They've been on opioids that leads to heroin because heroin's a lot cheaper, and then they get into trouble that way. Most patients are actually using cannabis to get off those medications. I think any medication can be addictive if you use it in the wrong way, so that abuse potential is there. But again, we're not seeing, you can't overdose from it, so you're not going to use too much and then end up dying from it. If you mix it with other things, you're not going to die from it. We have tons of patients on benzodiazepines for anxiety, and they mix that with alcohol, and then you have pretty bad mix for death there.
Insurance doesn't cover this type of medication. It's all out of pocket. So we help our patients find the right balance of minor cannabinoid treatments like CBD and CBG and these other very helpful cannabinoids that you can purchase outside of a cannabis pharmacy, as well as educating them how to shop in the cannabis pharmacy, plugging them in with the right pharmacist who can identify, okay, based on your condition and based on your symptoms, we think this would be an appropriate dosage form. It's not the perfect fit for everybody. A lot of times it's used in tandem with their existing treatment. We have a lot of pain patients who still take their opiates, but maybe they take 40 or 50% of the opiates they took before they were on cannabis. Because cannabis doesn't fight with the opiate. It actually synergizes with the cannabis, and they perform a similar function at each presynaptic nerve junction. We are trying to overcome the financial aspect of it because it is expensive to get a med card. So we're trying to set up different programs. We have discounts for veterans, we have discounts for Medicaid patients, and we're getting kind of a payment plan where people can just opt into just a small monthly fee instead of coming up with the whole appointment cost at the time of service. And that'll help them kind of budget in their med card and make it affordable for the whole year.
In recent years, with more research being done, the use of the psychedelic drug ketamine has become more common to treat those who are severely suffering from their own mental health struggles. With taking this drug, people are taken on a psychedelic trip to help break down their own psychological barriers.
Yeah, so I've been on antidepressants for 12 years, something like that. And those were always just okay. It just wasn't really helping as much as it could have been. I've gone through a bunch of different therapists. I think around middle school-ish. That's when I noticed the most, is I was just so anxious all the time. I would miss so much school just because I'd always feel sick to just even walk into the building. I would go into a classroom and just immediately I have to throw up. I have to get out of here or I'm literally going to die or pass out. I feel bad for saying this, but I'm kind of grateful for when school shut down, because it was just a relief of just I don't have to be in there with all those people. A month after graduation, that was probably the best I had felt, because it was just, I'm out of here. I don't have to worry about that. I can just see my friends. And then it started to like set in. I was like, oh damn, I'm an adult now. I think it was actually I was at like a party or like a get together, and someone started talking about ketamine, and I joined in conversation with them, and they were saying how much it helped them. So I thought that was something I could look into. And
I am a family nurse practitioner, graduated in 1997 from University of Utah. Got my doctorate in 2014 from University of Utah in nursing practice. I own the Lotus Center for Health and Wellness. I've always been super interested in alternative things, whether it be through supplements, TMS, massage, yoga, all the different sort of complementary and alternative treatments has always been a passion of mine. And so when I learned of ketamine, I was immediately on that bandwagon. And I don't want to make it seem like everybody who uses it gets better, but compared to what else is available, to people, for me in my practice, it's been something that far succeeds what has been traditional treatment options for people. So that's been exciting for me. So one of the things that ketamine helps to do when it's used in the right way, which means that, so there's two different ways. Let me just explain that you can dose ketamine. The way Spravato was dosed and used in research studies was a low-dose antidepressant dose. So what it does to the brain is it causes a release of a neurotransmitter called glutamate, which is a very excitatory neurotransmitter. So it helps relieve the symptoms of depression within a couple of hours of using ketamine. And that effect can last for 3 to 4 days. So the dose is given twice a week to keep those levels up to help relieve the symptoms of depression very quickly, as opposed to, for example, SSRIs, which may take up to a month before you start seeing relief in depression symptoms. Ketamine will do it within a couple of hours. So it's very fast acting, very effective. So that is one way that it is prescribed, and that is for people with treatment-resistant depression. So they've tried traditional treatment before, hasn't worked, or they're unable to take it. That's an alternative for them to use. Or if they are actively suicidal and you need something to help them right now, ketamine is a really good option. You can start them on an SSRI at the same time, wait for that to, take over in a month or two, and an immediate effect of the ketamine can help relieve their suicide ideation right away. Then there is the higher dose ketamine, which is the psychedelic dose, and that is done in combination with a therapist. We work with a therapist to talk about setting intentions to help them get to a place where they're getting stuck in therapy, where they've been trying to move through something in therapy. A psychedelic allows them to have different thought patterns that they don't have in ordinary consciousness.
I am a therapist at the Lotus Center, which is private practice. My official title is LCSW, Licensed Clinical Social Worker. So I did my undergrad in psychology at Utah State University, and then I did my master's at the U for about 2 years. Then you become a CSW after you pass this lovely, long, scary test. And then after about 2 years of supervision, you become an LCSW. CAP stands for Ketamine Assisted Psychotherapy. So essentially, we use a psychedelic, ketamine. There's other psychedelics out there, like mushrooms is the big one that people know, MDMA, those sort of things. But CAP, it uses ketamine, which is right now the only legal psychedelic here in the state of Utah. And for the majority of the states in the United States is the only legal one. CAP, simply put, helps people who are feeling really stuck, specifically maybe they've done years of psychotherapy or they have treatment-resistant depression, and we'll get them through stuck places to make it out to the other side and hopefully have that increase of mood, and those PTSD responses aren't as strong.
It differs from place to place, but they'll sit you down in a room. Sometimes they'll have a therapist present with you. Sometimes you're just in the room by yourself. But they'll come in They'll either inject it into you, that's what I had, or they'll do like an IV, and then you wait 30 minutes and you're just like left to your own thoughts kind of thing. And then the nurse will come back in, ask you how you're feeling, and then give you the second dose, and then leave you for like 45 minutes. And so that it leaves you with just a lot of thinking time, which was really nice. My first treatment was a little too intense for me. I got a little nauseous, just because like it was such a new experience that I've never felt before. But after that, the rest of the treatments went by really well.
Ketamine session, it's a 3-hour appointment. Previous to doing the CAP, they will meet with me, and they will also meet with an APRN to do a medical assessment so that they know the dosing, they know that they're ready to go. So once we actually get to the appointment, it will be me and our medical assistant who will be there with them. The first hour is essentially getting them comfy, cozy, on the bed, laying down so that they can feel safe. They're not moving, they're just hanging out. We make sure that they feel good about what's gonna happen, because it obviously can be a scary process, and so we make sure to go over any last things, any questions they have. The big thing that we figure out in that moment is audio. It seems like a silly thing, but audio is so important to ketamine. It really leads the experience. So either I, or if a client feels they want to kind of explore with that, we'll create a playlist to make sure they have something to guide them through that. They will also get an oral dose of Zofran, because ketamine can make you sick. Unfortunately, that's one of the worst side effects, is just feeling nauseous. We make sure they have an eye mask on so they can't see anything outside of their own experience, because if you don't have an eye mask on, you're kind of aware of the room. And when you're aware of the room, it grounds you, which normally sounds like a really good thing in therapy, right? To be grounded. But in this case, we want you to not be aware of what's happening, because that's what pushes people through where they're stuck. At that moment, they take the lozenge, and I will lead them through about a 10-15 minute meditation. And then our medical assistant will give them the actual injection that will take them to that psychedelic place. Without the injection, they're just feeling that high, floaty feeling. And then at that moment, my job is making sure they're physically safe. So if I ever feel clients concerned, a lot of times I'll just tap them on the shoulder and say, "You're okay, just breathe." The second hour is really boring, so I go over that one really fast. You're just sitting there. If you try to talk to a client, they would have no idea what's even happening. So I think people, when they hear ketamine-assisted psychotherapy, they think we're talking to them the whole time. No, that's not really helpful. So that's why we do a lot of work before and afterwards. So the third hour depends on each client. We're making them feel comfortable as they're coming out of it. They're gonna feel really disoriented, really dizzy, asking, "Hey, are you okay? Do you need to use the bathroom? Do you need water? How are you feeling?" And some clients, they just need the whole third hour to try to come back to reality. But some clients, we do a lot of talking. They'll come out of it and they just immediately want to talk about what they experienced. Any client immediately after ketamine will have a really hard time putting it to words. And so I'll ask them certain things like, did you have visuals? Sometimes people get the classic kaleidoscope colors that we all think of when we have psychedelics, but that's not always the norm. Some people just have really somatic feelings. Some people move, some people talk, some people lay totally still. And so if that's the case, that a client's more aware during that third hour, then we'll do a lot more talking and discussing. We also give them reflection questions where they can help gain more insight to what they experience. But I just say, just let it be. Whatever comes to you, comes to you. Sometimes people take a nap and that feels really good. Other times they'll just kind of journal their heart away. I have clients who will wake up and they'll just start journaling right there in that moment, and that's great if that feels good for them.
Ketamine is kind of a disassociative, but kind of in the best way possible. I don't know how to like describe it better than that, but you're just so disconnected from your physical body, but not like your soul and mind and all that. That's what I really liked about it, is that you were just so disconnected, and you knew that the most important thing was like the friends you have and the experiences and the like struggles you go through. Normally my thought process is kind of all over the place, but not like in any organized way, just in a way that is not efficient. I was able to think clearly without clouded thoughts and like getting distracted by other things. Like it was just kind of like a linear path of thinking instead of like it's all over the place. But like on my break days, I normally would go to the park and to like feed the pigeons and ducks and stuff. That was probably the most enjoyable part, was just being outside afterwards, and just you just feel so connected to like your surroundings.
So when they have that higher dose ketamine, they work with their therapist to really sort of talk about that journey, talk about what experiences came up for them and what that means to them, how that comes back to their intention, how that comes back to what they're struggling with. And a lot of that experience that they had, really helps them to shift their perspective, see things in a different light, and move past that trauma or thought process or whatever it was that they were really trying to work through in regular therapy that they weren't really making progress with. And it's that integration piece that really makes that work for them.
I can tell it's definitely improved a lot, because I wouldn't even think about doing this interview, but probably before ketamine, that would have actually shut me down completely. If someone put a camera in front of my face and was like, here, talk about yourself. And I'm going to like shows a lot more often because I'm managing a band. And I've noticed like I can talk to people a lot easier. I can hold like a decent conversation. Prior to that, I could probably get a couple words out before needing to like go on a walk or just like go on my own for a little bit. It definitely has improved things a lot, which I'm grateful for. They offer like boosters, so if I just start getting real down again and like my anxiety is really bad, I can call them and they'll give me like another treatment, and that's like whenever I need it, which is really nice. They do recommend you to see a therapist. I personally did not do that. I've just had a lot of bad experiences with therapists, and so I'll give it another try one day, but I don't think seeing a therapist would benefit me currently. I would just say it's definitely life-changing. Like I heard a lot of people talking about how it just changed them for the better completely, and I never really bought into that, just because there's no way that like you could be completely changed from like doing this sort of thing. But it definitely has improved me in the best way possible.
The journey of alternative medicine doesn't just stop here. With more research being conducted, doctors are finding more medicines that will be as effective, if not more, like the psychedelic psilocybin. While psilocybin is still only available for clinical research and not yet for legal or medical use in the US, there are states like Oregon and Colorado that have made it legal for medical use in a similar process to ketamine. The acceptance and treatment of mental health in the past 100 years has grown exponentially, and it is only going to continue. If you look at yourself or the people around you, you'll notice that everyone is on their own mental health journey, and it is our job to only treat those around us and ourselves with kindness, patience, and compassion.